Hi, this is James, and today we are diving into a topic that affects millions of people, often without them even realizing it: sleep apnea. Understanding it is important because the quality of your sleep doesn't just shape your night, it shapes your day, your health, and yet sometimes your partner's sanity too. If you find this kind of practical health content helpful, make sure to subscribe so you don't miss future episodes. Let's get started. All right, so let's define sleep apnea in the simplest and most clinically accurate way. It is simply a condition where a person has repeated pauses in breathing during sleep. That's very unpleasant. But importantly, we don't call it sleep apnea until those pauses happen more than 5 times per hour. These pauses can be apnea, where there is a complete cessation of airflow, or hypopnea, where there is a partial blockage or a reduced airflow. And since we like numbers in medicine, we also classify severity. So a mild sleep apnea is where you have about 5 to 14 episodes per hour. Now at this point, you have crossed the threshold for sleep apnea categorization. Moderate sleep apnea, there is 15 to 29 episodes per hour, and we refer to it as severe if there is 30 or more episodes per hour. Now, as you can see from the image on the slide, sleep apnea doesn't only affect the person with it, but partners often become unofficial study technicians, counting snores, timing pauses, and wondering if noise canceling headphones should be covered by insurance. But jokes aside, recognizing these patterns is key to early diagnosis and better outcomes. Now, sleep apnea comes in three main forms: obstructive sleep apnea. Okay, this is the most common type. There is a physical blockage of the upper airway, even though the brain is still sending signals to breathe normally. And then we have central sleep apnea. Here, the problem isn't the airway, it's the ventilatory drive, so the brain signal to breathe isn't strong or consistent enough to activate the respiratory muscles. And complex sleep apnea, this is when both obstructive and central components are present. A little blockage, a little bit of miscommunication, truly team effort. So, keeping these distinctions clear helps guide diagnosis and treatment and prevents us from, lumping everything into the snoring category. Well, frequent apnea episodes are not benign. They are associated with significant adverse health outcomes, including cardiovascular complications as well as increased mortality. And who is most affected? What do you think? Men, unfortunately, hold the higher prevalence in this condition. So, typical clinical features include excessive daytime sleepiness and fatigue, reflecting disrupted sleep architecture. Loud snoring, often accompanied by gasping or choking during sleep. Witnessed apneas, commonly reported by partners who may notice pauses in breathing throughout the night. Morning headaches, likely related to nocturnal hypoxia. Nocturia, which can occur due to sleep fragmentations as well as release of BNPs. Insomnia symptoms, such as difficulty initiating or maintaining sleep. Additionally, obstructive sleep apnea can impair driving performance. That's very important. And overall quality of life, affecting concentration, mood, and daily functioning. Obstructive sleep apnea is a recognized secondary cause of hypertension, making early recognition very essential. So, there are a couple of risk factors which can predispose one to obstructive sleep apnea, and they all arise from a combination of anatomical, neuromuscular, and other factors. So, looking at anatomic factors, increased neck circumference, skeletal structures of the jaw and airway, excess adipose tissue, the tonsil, and adenoid enlargement can also contribute, as well as age related degenerations. Okay, neuromuscular factors, you're looking at reduced muscle tone, effects of sedatives, alcohol, and smoking. Obesity itself is a major risk factor, amplifying airway narrowing. Now, all these factors that we have mentioned, okay, combined with the negative pressure which is generated during inspiration, what that does is that it actually increases the pressure in the surrounding tissues of the neck, that is, the surrounding tissues around the airway. Okay, and that leads to a pharyngeal collapse. Okay, and of course, to apnea, snoring, oxygen desaturation, and sleep disruption. So, later in this discussion, I will explain the mechanism of obstructive sleep apnea in more detail using the Starling resistor model. So, stay tuned. It's a fascinating part of understanding this condition. All right, so we're going to use the Starling resistor model to explain the mechanism of obstructive sleep apnea. So think of the soft pharynx in the red segment, which sits between two rigid structures, that is the nasal cavity upstream and the trachea downstream. So around the pharynx, right here, around the pharynx, there is a key concept called critical pressure, which is a pharyngeal critical closing pressure. The critical pressure is very important. Why? Because it is normally negative, meaning that it kind of pulls away the walls of the pharynx away from the lumen to prevent the pharynx from collapsing. So that means the pressure there is negative normally. Okay? In obstructive sleep apnea, critical pressure becomes positive. Why? It can be as a result of an enlarged neck circumference, neurological disorders, or obesity, excessive adipose tissues. All these risk factors can contribute to bringing the critical pressure to zero or to even positive. So, what is the effect of this critical pressure coming to positive or coming to zero? That means now that the pharynx is now going to collapse. Okay, it's now going to collapse. So that's very important. Now think of this. During inspiration, as you breathe in, what happens is that air speeds up through the narrowed pharynx, creating a negative intraluminal pressure that pulls the soft airway walls inward. Have you ever sucked in a straw? Okay, and what happens is that the straw collapses? That's the same phenomenon. If air goes into the airway, what happens is that inspiration is trying to collapse the airway. Okay, so we need the critical pressure to be negative so that it will keep the airway patent or open. Okay, so in obstructive sleep apnea, because the walls are already close to closing, they can collapse, especially as pressure in the trachea drops with stronger inspiratory effort. At some point, this part closes, and so air is not able to get into the trachea. This creates a choke point where airflow cannot increase no matter how hard the patient tries. And this is where we often hear snoring, that is the soft tissues vibrating as the airway struggles to stay open. So if the critical pressure is positive, the airway may snap shut completely, leading to apnea. This also explains how CPAP works in obstructive sleep apnea. It provides a continuous positive pressure inside the airway, raising the intraluminal pressure above the critical pressure, keeping the throat patent and open. The gold standard for diagnosing obstructive sleep apnea is overnight polysomnography. This is a comprehensive sleep study where patients are monitored throughout the night. During the test, we track electroencephalographic activity to assess sleep stages, pulse oximetry to measure oxygen saturation, nasal and oral airflow using temperature and pressure sensors. Additionally, there is also respiratory and cardiac parameters that will depend on the setup. So, polysomnography gives us a clear picture of breathing patterns, oxygen levels, and sleep architecture, allowing us to accurately assess the presence and severity of obstructive sleep apnea. Now, the management of obstructive sleep apnea focuses on improving airway stability during sleep and addressing contributing factors. So, the first line treatment is a positive airway pressure therapy, most commonly CPAP, which keeps the airway open by delivering a continuous positive pressure in the airway. For some patients, mandibular advancement devices may be preferred, especially when anatomy or comfort makes CPAP difficult to use. Lifestyle modifications also play a key role, including sleeping on the side to reduce positional obstruction, avoiding sedatives, alcohol, and smoking, which decrease airway muscle tone, and addressing underlying causes such as enlarged tonsils or adenoids when clinically appropriate. So, these approaches tailored to the individual help improve sleep quality, reduce symptoms, and protect long term health. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.